All right. Thank you, Jennifer. Thank you so much. And thank you, LeadingAge PA, for having me and hosting me today. I've got a really great presentation for you today, or at least I think it's a good presentation. The biggest thing we're talking about overall in healthcare is the staffing crisis. And so what we're going to talk about today is actually hearing from the nurses themselves and how they are viewing the nursing crisis. And we did a survey. I'll get into this in a minute, and we got their tips and tricks on what they want to see and hear and feel and everything else. And don't worry, not every tip and trick costs money. There are some great things that I'm going to be able to share that won't cost you a dime and will help you get the nurses and healthcare professionals that you need into your building. So without further ado, let's get started. So I got three main objectives for today. Number one is to evaluate the current state of long-term care nursing. We'll talk about the survey that we just completed, and we'll talk about the insights that we learned from that. Next, we'll talk about 5 key strategies that facilities can implement immediately. So we're going to talk about 5 things that we've learned that these healthcare professionals, like my friend Jessica right here, that they want to see and that you can implement to get the healthcare professionals in your building. And then lastly, we're going to talk about assessing the prospective influence of technology. We're seeing a lot about AI, and we're seeing a lot of, I'm sure we're all getting emails and texts and social media posts about different technology that's coming into senior care. I've evaluated several of those and have those ready to come out with you. But throughout this entire presentation, as Jennifer mentioned, if you have a question about something I'm saying, feel free to put it in the question box. And I want to make sure that everything I walk through is, as clear as possible, so that when we get off of this conversation at 2 o'clock, that you're able to walk away with some real valuable information. So as Jennifer mentioned, my name is David Posner. Full disclosure, I work for a company called ShiftMen. I've been there for the last 6 years, one of the first employees there. Our company has over 350,000 nurses on our platform. We're over in 158 markets. We've provided over 4 million hours of care. As far as myself, undergraduate from University of Maryland, graduate degree or MBA from George Mason, over 20 years of healthcare experience, starting off in pharmaceutical and medical device and working the gamut. But the last 10 years have been in senior care, starting off in home care services, home health, working with communities, facilities throughout the great Mid-Atlantic region. And so hopefully I've got some information that's worth sharing and that I can provide for you all today. So let's get into it. Engaging our workforce, nursing workforce, from results of our survey. And so the nice thing about this survey is this was actually done throughout the state of Pennsylvania. So we are a national company, we're in 38 states, but the survey we did was actually last summer, and we are doing one this August. We'll be doing another one this August, but this one was actually done last summer. But all 500 nurses were actually from Pennsylvania. So all of the details and everything that we're going to talk about is specific to this great state of Pennsylvania. The survey included, we partnered with Wakefield Research to do the survey, and included 500 nurses. So 400 of those were RNs, 50 of them LPNs, 50 of them CNAs. Again, between August 4th and August 15th of last year. So let's get into the data. I always want to kind of start my presentations with data, because I think this is what kind of hits home and really sets the groundwork for what the nurses are actually feeling. And the truth of the matter is they're feeling the shortage. And it's kind of a nice awakening in the sense of, you see right here, this 99%, starting on the left-hand side, 99% report shorting staffage at work. So think about it this way. These nurses, and when I say nurses, we're including all of them, so CNAs, LPNs, and RNs, they are walking into your building every single day and coming back the very next day, knowing that they're going to be short-staffed, knowing that they may have to be asked to pull a double, knowing that they're going to have to work with more residents or more patients than normal. They know this, and they still come back to work every single day. When I first saw this that they're literally walking into a situation where they're going to have to pull doubles every single day or work more every single day, that just really kind of hit my heartstrings as far as they must really love what they do. And we really got to do everything we can to help them enjoy what they're doing. Because if I knew that I was walking into a situation where almost any other situation, a basketball game where I was going 1-on-5 or just going into work a shift somewhere else, and I knew I was going to be short-staffed, I might think about going back maybe after day 3 or day 4. Most of our healthcare professionals that we know, the ones in your building, have been going back for 5, 6, 7 years, and they are aware of the shortening crutches. So let's just make sure that we thank them every single day for kind of coming in. 94% report that this is having a negative impact on them. And this is where we really need to start to be aware of what is going on. And it goes with this 40% having an impact on their mental health. And what this is starting to help us realize is it's starting to take a toll. Yes, they're coming to work every single day. Yes, we love what they do. Yes, we really appreciate them. And they're godsends for coming back to short staff. But it's starting to have an effect on them. And we're seeing this, during COVID or after COVID, we saw the great resignation. And if we continue to do what we're doing, we're not going to have the healthcare professionals that we really want. So, we're going to talk about some things that we can be doing this to kind of work with them. But as far as mental health, one of the simple resolutions is just talking to them and ask them, how's your day going? How's everything else going? How's everything at home? Do you need to take a little bit of a break? What can I help you with? And especially an administrator, having those conversations is huge. Most of these healthcare professionals don't think the administrators know who they are, let alone know who their name without looking down at their name tag. So simply walking up to them and just saying, hey, how's your day going? Hey, how's everything at home? Hey, is there anything I can do for you? Simple conversations, every single day to let them know that you really care, that you love them and you support them, really, really will go far. The last stat, this 49% report concerns over adequate care delivery operations. Now, I know we're not going to have the back and forth I usually get with a live audience, but one of the questions I want you to think about to yourself is, do you think your nurses know what the state regulations are for nurse to patient ratios? And the reason I bring that up is because I think personally, and from conversations I've had with a lot of the healthcare professionals as well as a lot of the administrators, it's that these nurses think that there's not being good quality care, because of they're so short-staffed. But in reality, I know you as administrators know that you're meeting the standards that are required by the state as far as census and everything else. But so making sure that the healthcare professionals know what the ratios are going to be, if they're 8-1, 10-1, 12-1, whatever they might be in your buildings, based off the state and what type of buildings you have and based off your census. But letting them know, hey, this is the ratios that is required by the state. These are what we're doing. Hey, if you're a facility that's better than those ratios, let them know that. Because you might be, it might be an 8-1 and you're 4-1. You're doing everything right, and the nurses still think it's not adequate. So let them know, hey, just so you know, the state regulations for staffing is 8-1. We're going above and beyond and 4-1. So help them out. A lot of these nurses also want to learn and grow into possible other positions. So the more you educate them on what they're doing, it just helps with overall communication. It helps with overall knowledge of what's going on in the industry, and it'll really help with everything else that's going on. Now, the biggest thing is this next stat I'm about to share with you. Again, I wish I had an open audience, but I want you to either think about, maybe put in chat, maybe a question box. But here's the question for you. What percentage of nurses are already thinking that they may not be here in 2 years? Let me say that again. What percentage of nurses are already thinking that they won't be here in the next 2 years? Now, some of you are probably saying 70%, some of you are probably thinking 10%, 20%. Well, here's the answer. 65%. Yeah, 65%, more than half, are thinking about leaving the profession in the next 2 years. And that number's up from 18% last year. So this is getting harder and harder. This is, we all know that we're seeing assisted livings and rehabs and hospitals being built in our areas, wherever you come from. If you're from Scranton, from Philly, from Pittsburgh, wherever you're coming from, you're seeing other facilities being grown. We know the gray tsunami is on its way, and we're short-staffed now. Could you imagine if we start losing the staff we have now and there's more seniors coming? That's why this stat has such a huge impact, because we've got to realize that these nurses, 65% of the nurses in my building right now are already thinking about leaving. And so we've got to buck the trend. We can't continue to grow. We've got to figure out a way to be able to help these nurses and show them that we care, and show them that this is where we need you. We want you to be here, and providing that type of community that helps with this. But this was the most startling statistic I have. So if you want to take a screenshot of this, I'll hold this up for an extra 30 seconds. But this is one that should, if you're in HR, if you're an admin, if you're, this is one that you want to kind of have on your bulletin board saying, hey, this is not going to happen to us. We're not going to have 65% of our staff turn over in the next 2 years. All right, so let's talk about the financial challenges, because we all know that, unfortunately, a lot of our nurses are working paycheck to paycheck. As you may or may not know, this is a national number. $16.88 is the average wage of CNA. The craziest thing is Chick-fil-A is paying $3 less. And that's where these healthcare professionals are going. When they leave our industry, we're not just talking that they move to a different hospital or rehab, assisted living. When they're like, I'm done with this, they're not becoming lawyers and doctors. They're working retail. They're working at Chick-fil-A. So they're taking $3 less, $3.50 less, to have an easier job. And that's essentially what they're looking for. I mean, that's what they're looking at, right? They know when they walk into our buildings, they're going to have to do it, scrub the bed, bathing, toileting, dressing, helping, doubling up, all of these things. They have to do so much when they walk into the building, helping with multiple different families, dealing with the personalities of the families that we deal with. Or for $3 less, they can literally say, do you want fries with that? Right? I mean, that's what we're talking about as far as job here. So $16.88, healthcare, we all love healthcare. We know what we're doing, but we also know it's a lot of work. And so for $3 less, they could literally say, do you want fries with that? And that's where they're going. That's the avenue that these healthcare professionals are choosing. When they leave our industry, they don't want the stress that our current facilities and communities are providing. So we've got to find a way to be able to work with them financially and otherwise to be able to help them out. Here's the other stat, this one all the way to the far right. Most CNAs need to work about 52 hours a week to make ends meet, right? So we all have the standard 40. Again, so ShiftMed, as a disclaimer, we are a staffing agency. So we're doing per diem staffing. Most of the nurses that are on our platform actually only work 2.5 shifts a week. They're working 40 hours in your building, but in order to make ends meet, they're picking up 2.5 extra shifts from us. That's most of the nurses that we're picking up. They're coming to us and they're picking up those 2.5 hours, they're 2.5 extra shifts, just for the sole purposes of being able to make ends meet, being able to put bread on the table for their families. And most on our survey, most of the healthcare professionals have the good old standard 2.5 kids, and most likely either taking care of children that are either under the age of 18 or they're taking care of their adult parents. So they are caregivers at home as well as essentially in the office or in the buildings. So in order to be able to meet those financial needs, they need to be working more hours at the current rate of $16.88. So just kind of starting to put, from a financial point of view, I'm trying to put all of this stuff into perspective for you. And hopefully this is all kind of making sense and going on. So what are the nurses looking for? So again, we ran our report and we asked them straight up, what are you looking for? What do you want? What do you need? So higher pay, right? You knew this was going to be the first one. 61%. I'm actually surprised it's not higher. They want higher pay. 41% more paid time off. Now, this isn't to necessarily take vacation time. This is to be able to take out time with, again, their children or their adult parents or something like that. But other ways that I know other facilities are able to kind of work with them are being able to offer things like paid time off to be able to work with them so they can get that mental break that they need and, show everyone that they care. There we go. 41% of nurses want lower nurse-to-patient ratios. We just talked about this. And again, this goes back to, do they really know what the nurse-to-patient ratio is? And that's a question I'd ask back to you in all your facilities commutes. When I did this live in several other states, I think one, maybe 3 or 4 hands rose that says, the nurses actually know what the nurse-to-patient ratio is. So I'd have those discussions, or ask them, hey, just curious, what do you think the nurse-to-patient ratio is required by the state of Pennsylvania? And see what they say based off our current census, and see what they say. And you may be surprised, and it might be worth a good discussion. Again, especially as an administrator or somebody with authority, having those discussions, be able to open their eyes. Oh, this is how this works. Oh, this is really interesting. Oh, I didn't know that. Okay, now this actually makes sense. Or if you have any reasons why, certain the ratios are what they are, being a little helpful. 1 in 4 want to choose their own shifts. So this is one of the ideas that I want to start to kind of lock in your head as far as this flexibility of shifts. So a lot of us have the standard 7 to 3, 3 to 11, 11 to 7s. But does that really work with the schedules that people have today? Are we able to kind of play around with part-time shifts? Are we able to play around with, instead of going 7 to 3, maybe changing up to 9 to 5 or something like that that might coincide with school for their kids or a parent's job or something like that? So being able to give a little bit more flexibility, you'll see is going to be one of the things that also comes out of this survey. In addition, being able to choose their own shifts. So maybe Mondays aren't good for somebody, but Saturdays are really good for somebody else. So giving them a little bit more ability to pick and choose their own shifts will give them the leadership. And maybe it's an earning thing. Maybe it's something that they've, if you've been here for 2 years or you have excellent attendance, you earn the ability, to have first right refusal over shifts. And we see this in the restaurant industry all the time. The senior person gets to pick, which shifts or what tables. Bringing that type of restaurant mentality over to ours might be something that it takes to keep the nurses working here versus going to Chick-fil-A. And again, 93% want more control over their schedules. So again, working right in line with what we're talking about as far as flexibility, the ability to have full control or start to have control over their own schedules so they can, get around being able to work with their kids or work with their loved ones can have a huge impact. And Google agrees. So here's the most interesting thing we learned, or when we went back and actually did. So Google puts out a survey every single year, and what they're looking at is in combination with Indeed, and they're looking at jobs that are posted. And what they found is, with the pandemic, people wanted to work at home and work part-time. But one of the things that really hasn't dropped is part-time work. Think about it. A lot of the, maybe our friends that are starting to work, worked at home during the pandemic realized they could pick up part-time jobs and part-time work at other places, right? And so what we found is these nurses and CNAs also want that type of stuff. Think about it from an older CNA or LPN or RN, a retired nurse who wants to be able to work just a part-time shift. Just work instead of a 7 to 3, maybe just a 7 to 11, something like that. And being able to just work part-time, a couple hours here and there. Think again, why Uber has taken off. Why is Uber taking off? Because again, I want to be able to work when and where I want to be able to work. What if we be able to bring that to into our facilities, into our communities? Being able to have more healthcare professionals available because we're offering different types of, because in the most part, a lot of our buildings are so short-staffed that we just sometimes need a body, and we'll take a body for 4 hours. And so being able to offer out part-time shifts and flexibility shifts, we're seeing, again, Google is really is kind of confirming all of this, that these, part-time work is on the rise. People are picking up part-time shifts. So you may have someone who might be an accountant that might want to pick up a couple, nursing shifts on the weekend to make ends meet. So instead of picking up Uber or Chick-fil-A, they work at your facility and community. And so what a great, be able to build up your retention pool and number of nurses that are available to work for you. So I want to kind of prove this point with an interview that we did with one of our nurses, Holly. So I'm going to play. Let's see if I can make sure this work. Play a quick video for you all. Okay. Let me go back to that. So first question I have for you, and I love asking this question with the audience, is how many of you offer next day pay? I mean, if you want to put that in the question portion, raise your hand. But when I've done this presentation, maybe 1 to 2 people raise their hand. And those that raise their hand, I always ask the follow-up question is, how has it helped your recruitment? And it is night and day. If you have the ability to offer next day pay, I think ours shot up almost 50%, our Indeed ads, when we literally put that we offer next day pay in the tagline on our Indeed ads. It shot up like 50% of the people that grew as far as number of people that applied for our ads. So look into your payroll system. See if this is something that you can offer. If you can offer next day pay, and quick side, how this really works is they're able to take out like 50% of their wages the very next day. So it's not like the full amount. So it's, but as we know, a lot of these nurses are working paycheck to paycheck. And so having that ability to offer next day pay, you're going to see a lot more want that type of benefit when they're coming there. So if you're not doing it, please look into it. If you want more information, again, you can contact me afterwards. And I know there's a couple other facilities and communities that are doing it that it's been night and day. The other part of the video that I want you to watch and make sure is flexibility. So you heard from her own words, and one of the nurses actually say it allows her to control her own schedule. It allows her to pick and choose the shifts that she wants. This is why she chose, again, ShiftMed offers this, but this is what she wants. She wanted to work in a nursing facility that gives her that type of flexibility. So if you have the ability to offer different types of shifts, flexible shifts, this is something you may really want to start to consider. And here's what we've learned. This is from the government list of who's growing and who's not. July 2021 over July 2022 as far as healthcare industry. And one of the things I want you to realize is two things. One, we see that child daycare services is up 8%. Why? What is daycare? It's 9 to 5, right? So again, that type of set that I can work when somebody else is working. The other one I wanted you to kind of pick up on is, where is home health services? Home health services is up 3%. I think it was home health, hospice, and so home care services. Why? When you look at hospice and when you look at home health and when you look at home care, what do they offer? They offer the flexibility. So our nurses that are leaving facilities and communities and they're staying in healthcare are going to flexible, are moving to flexible. They're not going from one facility to the next. They're going to more flexible types of jobs like home care, like home health, like hospice, and those are the ones that are able to offer them that type of flexible schedule that they really are looking for. So again, you see me hitting this theme over and over again as far as the flexibility. That's really what I want you to kind of to understand.